Hi, I'm Krishna Manyan from Hospital Management Asia 2015, and I'm here with you in Yangon, Myanmar. So today we have Mr. Edelstein. So he is from Elsevier. He is the Chief Medical Officer, and thank you so much, sir, for being with us
It's
today.
my pleasure.
So to start off this talk, I would appreciate it if you could give me a short background or clue of what Elsevier does.
Certainly. So Elsevier is really the oldest publisher of medical and scientific content. We actually publish more than 25% of the entire world's scientific content, journals and books, including some very, very famous titles, Netter, Gray's Anatomy, these types of things, The Lancet. But as you probably know, the days of just doing books and journal are rapidly going away as our children and everybody's on their cell phones. So Elsevier has greatly grown into a health information technology company globally, where we use all of that great knowledge and we put it into solutions that doctors and nurses and patients and pharmacists can use to improve their care.
That sounds like a lot of work.
It is a lot of work, and we have dedicated people all over the world, and a group that's very proud of our history, but also very excited about where we're now going.
Since you seem to have a lot of clue of what the healthcare does, do you think that there is a way out of the ever-increasing healthcare costs?
Yeah, it's a question that's being asked everywhere I've been, from the United States to Europe to the Middle East and now to Asia. Is there a way out of this financial spiral? And it's going to sound strange to say, but I honestly believe the way out initially is by spending some money on technology. The reality is, what makes healthcare so expensive is when it's done very poorly or in a number of different ways. For example, I'm a surgeon. If you come to me for surgery, though you're way too young, if you come to surgery and I do a very good job and the nurses do a very good job, and then when you go home you know how to take care of yourself, that's very good care that doesn't cost so much. If you come to me and I do a poor job, so you're in the hospital for a long time,
You keep coming back.
or the nurse does something so you get even more ill, or you go home and don't take your medicine, it's not only worse for you, but you have a lot more money invested in your care. So if we can get doctors to stop practicing in such a range, get doctors to practice up here, nurses up here, and then educate patients up here, that better care costs less money.
So if you're saying is that if the care is efficient, then the healthcare costs will be lower.
That's right, and we sort of laugh about it because that's different than everything else. If I want to buy a nicer car, it costs more money. If you want better quality health care, it costs less. But right now, you have to invest in that technology and those solutions. So it's going to take a little more money to stop wasting money. And meanwhile, everybody gets healthier.
That sounds like a good future to look forward to. So for that kind of future, what kind of training do you think hospitals should give their staff?
So hospitals have to, first of all, accept the reality that not all of their care is good. And that's very, very hard for many, many hospitals and many doctors and many executives to accept. But we know from the information that many, many patients are not getting good care everywhere around the world. So the training starts by accepting the importance of using what we call evidence-based information. So proven techniques. And then have everybody in the hospital, the doctors and nurses and pharmacists, having rapid access to that information when they need it to care for the patients. So if you can get them to accept that need, the solutions we make go into the hospital and go into the physician's office to help everybody practice care more consistently and at a higher level.
Maybe my last question. So what is the latest product or service that your organization is offering to hospitals or even clinics?
So we have a huge suite of products for nurses, pharmacists, physicians, patients. It's an enormous selection. But we're very excited that recently we acquired a company that specifically leads the market, the best company in terms of radiologist support. And this tool called Amersys Amersys allows radiologists who are looking at a complicated MRI or CAT scan or image and trying to figure out what's going on, to have access to information written by the world's experts and thousands of other images to compare it to figure out what's going on for that patient. They also now are moving into pathology. So if there's a biopsy and you're not sure if it's cancer or not, you see what's written by experts and you bring up an image of a bunch of different types of cancers and see. So Amersys is our most recent acquisition and we're very excited about it.
It sounds really cool. I think that reduces the time that doctors or any nurse will guess on the patient, and maybe even the patient coming back because the problem was not solved.
Absolutely, and you can imagine how serious it is to get something wrong when it turns out to be a cancer and you didn't get it right, or other way, you said it was a cancer and they undergo a procedure and it's wrong. So that's truly clinical decision support, and Amersys is a great new Elsevier company.
It's really cool, and I think that reduces also the amount of people getting mad at the hospital.
I agree. And in my country, in the United States, of course, there is a lot of litigation over these things. One of the most common causes of lawsuits in the United States is the incorrect reading of mammograms where people miss breast cancer. So Amersys can help reduce that. So it's a very exciting company for us to have now.
That's really cool. I wish I would want to see that soon. So thank you so much, sir, for spending time with this interview. So I think that's all the time we're going to.
I appreciate it.
You seem to have a fully loaded schedule today.
Yes, I do.
Thank you
you very much.
I hope you're enjoying it. HMA.
I am. It's a terrific conference.
Thank you, sir. So that's all we have today with Mr. Peter Edelstein. Thank you so much for watching.